obviously, if I needed to, I would get a new set, since that kind of touched the side. Alright, so I'm gonna grab this, set this up. I put sterile water in there. I'm gonna grab the suction thing. Like I said, if that was folding over, I would get a new one. I'm gonna throw that down, throw it away. Alright, so now I'm gonna have one dirty hand and one clean hand. I'm going to attach this. I'm gonna test the suction, make sure it's working. It is. So I'm going to do intermittent suction. I'm gonna put it down on the trach, and whenever I hit resistance, I'm gonna pull up to 2 inches, and then I'm going to suction intermittently as they come out for 10 seconds. So, hit resistance, and then I'm going to go up 2 inches and then suction intermittently for 10 seconds. I would ask the patient if they feel like they need more suctioning. If not, then if they did, I would wait 2 to 3 minutes and then I would do it again. But in this instant, they don't need it, so I'm going to take that and attach, pull that out, and I'm going to throw all of this away. I'm going to make sure they're doing okay throughout the whole suctioning and throughout the trach care. I'm going to throw this away. I'm going to do hand hygiene. I'm going to let them know that I'm about to do trach care now and clean. So I would take this out. Hand hygiene. I'm going to put my sterile gloves on. If it rolled, I would get a new glove as well. Alright, so I'm going to take this, set up my sterile field. The 1 inch margin is non-sterile, so I just need to be aware of that. Pull that out, pull that out. Alright, so I'm going to get everything set up. I'm going to take these chips out. I'm going to leave this in here. So I'm going to open the peroxide, the hydrogen peroxide, open it up, pour it in there. And then I'm going to take this, the sterile water, and pour half in here and half in there. And now I'm going to have a non-dominant and a dominant hand. So it's going to be my dirty hand. With my dirty hand, I'm going to grab the trach out. I would always assess, make sure they're still doing okay. I'm going to hold it and clean it, but make sure I'm above this little tray so I'm not contaminating the rest of my sterile field. Make sure you're cleaning it really good. And then I would drop that in there, and then I would take it out, and I would drop it in here for a second, and then I'm gonna knock it off. Alright, are you doing okay? Alright. So then after that, I could take, I would take my gloves off, and then, because now they are soiled, and I would put a new pair of sterile gloves on. I would do hand hygiene. So I had taken that little gauze that was up there, and I would, if I need, I already taken it off, so if I needed to, I would clean it, and I would take, like I said, I have new sterile gloves on. I would take a little 4x4 and clean around it if I needed to. And then I would let it dry, and I would make sure it's dry because I don't want to have skin breakdown or anything like that. And then I would take another one and I would put it back to where it was, or put another one, a clean one on there. I would have maybe another nurse come and help me because this can be a little bit tricky because you want to make sure it stays pretty clean and sterile around there. So I put that back on, and it would be a little easier on a real person because they can hyper extend their neck and like help me, and their neck can move, unlike these dolls. So I would try to stay as sterile as possible when putting this in. Like I said, I could have a partner if I needed. For the sake of the video, I'm just gonna act like I got it in there, but make sure you try to stay as sterile as possible. And I would change the collar if it is soiled, but if not, in the sake of this video, it's not soiled, so I'm not gonna have to replace it. But like I said, just make sure you have someone to do it with you. And whenever I'm done, I would document any drainage that came out. If the patient had any issues, I would put the oxygen back on. I would put the oxygen also back down to what it was the previous setting before I started hyperoxygenating the patient. I would turn the suction off, and I would just document any relevant data. I would make sure I checked my safety checks and the call lights in reach. I would lower the bed again